Hello, my name's Ben Dyson. I'm the Executive Director of Strategy at NHS Improvement, and I'm responsible for the work that we do on costing, on payment models and on pricing. And I've had a long-standing interest in how we can use cost data to improve quality of care and health outcomes for all patients, so I'm delighted to be involved in this agenda. Why is this so important? Well, at its heart, we know that because of the rising demand that comes from an ageing population, from increasing numbers of people living with long-term illness, and from the increasingly constrained funding for the health service, we know that it's vital now more than ever for the health service to understand how it's using its resource, its people, its assets, its consumables, how it's translating that resource into different types of services for patients, and in turn what all of that means for quality of care and health outcomes. Patient level costings, when done correctly, when information is collected and recorded in a consistent way, is an incredibly powerful tool to help both organisations and wider health systems understand that relationship between activity, costs and outcomes. And we know from health systems the world over that one of the critical ingredients in being able to drive continuous improvements in quality and efficiency of care is precisely that ability to understand your resources. So the Costing Transformation Programme, we think, is vital for the work that every provider organisation needs to do to understand its business. It's vital for the work we're then doing on benchmarking, and it's really those two things together, the ability to understand your business and the ability to compare how you're using resources with others, that can be so incredibly powerful in helping you drive improvements in quality of care and outcomes. There's a further reason why this is so important, and that's that with the increasing emphasis on getting commissioners and providers, primary and secondary care, health and social care to come together to collaborate better in the interests of local communities, and we're doing that through sustainability and transformation partnerships, through integrated care systems. All of that work at its heart is about stepping back and thinking, how do we use our collective resources more effectively for patients? And you can't do that again without reliably collected and recorded data on patients. As you'll know, one of the other increasing developments in the health service is that we are seeing a number of places move away from traditional payment models, particularly for acute care. We're seeing people experiment with whole population budgets, with capitated budgets, and with blended payment models, often involving some kind of risk share between organisations. We're indeed working with a number of integrated care systems to understand what those potential new payment models might be. But it's really important to emphasise that those systems require, in fact, more than ever, that reliable, high quality information about patient costs, because without that you can't understand what services you can reasonably expect for a different level of funding. So I hope for all of those reasons it's clear why the Costing Transformation Programme is so important. And I'd just like to finish by thanking everybody who's been involved so far, and everybody who's going to be working on the Costing Transformation Programme in the future, for all the fantastic work you're doing to really put this at the heart of the work we're doing on more collaborative and more integrated care.